Okay, one of the most complicated issues we have in life is healthcare. And now that I'm 65 and Kathy is too, we in the last 5 years have really stepped up our involvement, interaction with healthcare. And there's just a lot of issues with it. You have all kind of tests. You've got doctors, you've got insurance companies, and then you, well, then underneath it all, you got how you feel and whether or not something's wrong with you. And I don't know, it's crazy and expensive. I talk to people all the time, or hear them talking, that, talk about $1,300, $1,500, $2,000 a month premiums, and their co-pays are astronomical even at that. And we've just gone through the Obamacare, and now I don't know, I forgot what the Republicans called what they couldn't get passed, but whatever, care, and now they're working on it again. I have never taken the time to delve in and understand what all it's really about. The Obama thing struck me as very socialistic, and I think that's one of the biggest problems with healthcare is the dimension to which government is involved. I believe that we are in a free enterprise capitalistic economy and society, and the principles of that setup are what we ought to follow in all dimensions that pertain to money and living and whatever. So when it comes to healthcare, I just have four thoughts. I'm not smart enough to know what to do with them, but I just throw them out there and maybe it'll stimulate somebody's thinking who knows what to do. But number one, I believe government needs to get as far away from healthcare as possible. We just don't need government involved. And my biggest chronic complaint practically my whole life is the FDA with their protracted approval process. We get people that invent or develop a treatment, a drug, whatever it might be, and it takes 5, 10, 12 years. What is going on? I realize research has to be validated and safeguards have to be in place and all of that, but come on. There's some people with big egos in there somewhere. Another thing about government, we just have countless rules and regs. And so often the people that are out there doing the job, from first responders to specialists and residents in hospitals, are having to deal with all this waste of time and resources. It's crazy. Some regulation is necessary. And it's necessary when competition cannot come into play. And that leads me to number two. Things that engender competition need to come into place. I get frustrated watching new hospitals go up and they look like the Taj Mahal. You come in the lobby, it's like a 5-diamond resort. What has that got to do with healthcare? Who are they impressing? They need to get into a situation somehow, somebody needs to do this, where they're competing for patients. And when they have to get mean and lean and get their stuff trimmed down so they can bring the price down, all it would take to solve a lot of these exorbitant fees and stuff is a little competition and somebody get a brain about what kind of a building to build. It obviously doesn't need to be a dump, but it doesn't need to be the Taj Mahal either. A third thing, I think we still have tort issues that need to be revisited, especially malpractice insurance matters. To the best of my understanding, about 20 years ago is when this came to a real head, a crisis with malpractice insurance. And obstetricians, for instance, were just closing their practices one after another. They couldn't afford insurance. Why was the insurance so high? Because the lawyers were suing and winning these astronomical lawsuit numbers, and it just screwed up the entire system. And we used to hear about tort reform. I haven't heard those two words in I don't know how many years, and I think it needs to be revisited. I mean, if somebody is the victim of malpractice, malfeasance on the part of a medical individual, sure, there ought to be compensation, but they shouldn't have to come away with enough money to start a third world country. It's just been crazy. And then the fourth thing is to allow treatment decisions to be made between doctor and patient. The insurance companies get involved and they don't want to pay because they want the money. That's understandable, and they need to be profitable. Again, if competition came into that dimension, it would make a lot of changes as well. But if a doctor says this patient needs this test, needs this procedure, and he's not motivated saying that because of potential lawsuit, see how this is all intertwined? Whew, drive you nuts. Are you smart enough to fix it? Maybe these ideas will help. Peace out.